Again, this is Bill Riley with Medical Advantage. Thanks again for joining us for our latest CPC Plus webinar. Today we're going to be covering maximizing HEDIS for enhanced quality and revenue. Before we introduce our speaker, Amanda, I want to cover just a couple of things real quick. We got a large number of people on the line with us here today, so we're going to be keeping all the phone lines muted during the presentation. We will be pausing at the end for questions, so please leverage the little question box in your GoToWebinar panel there, and we'll pause at the end and address as many questions as we can. The other thing is that we will be sharing a copy of Amanda's presentation as well as a recording of this session to all of you. So you'll have that either later today or tomorrow. So with that, I'd like to take a minute and introduce our speaker, Amanda Phaneuf. She's a member of our team here at Medical Advantage Group, one of our practice transformation consultants, supporting over 40 practices in the area. We think we've got a few of you on the line from some of Amanda's practices, so that's great. Amanda helps with quality improvements, PCMH certifications, and is always looking to leverage her HEDIS experience to help practices maximize reimbursements in performance-based contracts. Amanda is a regular speaker at medical conferences. Those of you joining us from Ohio today may have seen Amanda recently at the Ohio State Medical Association annual event last month in Columbus. So with that, Amanda, we'll turn it over to you.
Great. Thank you, Bill. Thank you, everybody, for taking the time to register for today's webinar. We're going to cover a few different kind of topics today surrounding HEDIS. So first, we're going to talk about HEDIS, give you a little bit of background information about what is HEDIS. For some of you who don't know what HEDIS is, it might be a beginner's kind of opportunity for you to understand what HEDIS is. And then we're going to dive into HEDIS a little bit more in depth to give you more of a defined understanding of what HEDIS is, as it is a very large beast in the healthcare industry today. And then we're going to give you some tips on how to improve quality scores in your practice, so that way you can ultimately earn your providers the incentives that are offered by the health insurance companies. So we'll first begin with an intro to HEDIS, like I mentioned. So first of all, if you weren't aware, the definition of HEDIS is Healthcare Effectiveness Data and Information Set. So that doesn't seem to kind of clarify what HEDIS truly is. So with that being said, we're going to go into a little bit more in depth of what exactly HEDIS is. But before we do that, I wanted to kind of find out and gauge our audience on the phone today of kind of understanding who is familiar with HEDIS before today's presentation. So if you could take a moment to provide us with your response, and then we'll go from there. Perfect. So it looks as if most of you have heard of HEDIS prior to today's presentation. So some of this might be a repetitive for you, but it's always good to have a good understanding of what HEDIS is, and there might be things that we talk about in today's presentation that you weren't aware of prior to today. So moving on, we'll talk a little bit about the background of HEDIS. So HEDIS is a standard set of quality measures. So what does that mean? So NCQA created this list of HEDIS measures that are essentially preventative care services, things like mammograms, childhood immunizations, lead screenings, colonoscopies, things of that nature. And what they do is they have brought that down to the health insurance companies, where majority of the health insurance companies in the nation kind of gauge their performance based on how providers are completing those preventative care services. So from there, when a provider completes that preventative care service, the data goes directly to the health plan, and we'll get into that in a little bit, how that goes to the health plan. But the data goes directly to the health plan, and then their scores are aggregated and scored on a national level, and all of the health plans then get to determine how they rank amongst their peers as far as in the state that they are currently residing in, and how they rank against peers in other states. From there, the health plans are ranked from 1 to however many health plans there are in the nation. And based on that, they might receive additional funding from federal or state agencies based on that. Moving on. So in order for the health plans to receive those good rankings from on a national level, they needed to kind of partner with provider practices so that way they can directly impact their performance by incentivizing those who are actually performing the services on a day-to-day basis. So what they did is they kind of all came together and they kind of determined, okay, which incentives, which measures do they want to incentivize? They want to incentivize those that are services that are most commonly performed, and then they're going to determine, okay, do we want to set goals for the providers? Does it have to be, do they have to meet a certain percentage in order to earn that incentive, or is it like a fee for service? If the service is completed, they're awarded an incentive. And then the health plans kind of offer their incentives to the providers, and it varies practice or health plan to health plan based on what the health plan has deemed that they want to incentivize providers. Now, most insurance companies offer pretty comparable incentives by measure to providers to remain competitive amongst each other. So there usually isn't much of a variation in those incentive dollars. And then CMS is also experimenting with those performance-based payments through programs such as MIPS, CPC Plus, and others. So we talked a little bit, I mentioned a little bit about how does the health plan get the data from your practice and then report it nationally to get their scores. So there are multiple different ways that they can actually get that data. So it's broken into two categories: standard supplemental data and non-standard supplemental data. So standard supplemental data is things that are coming directly from your EMR, an EMR interface such as like a registry such as Wellcentive, the labs, county or state registries, whereas non-standard supplemental data is kind of, it's not a direct source, so it's things that are kind of an intermediate from your direct source, which is your EMR or your registry, to the health plan. So these are things like a provider portal. So if a patient presented in the office, you billed for the service, and the patient's still showing up on your gap report, most insurance plans offer a provider portal where you can actually report completed services that way. It can be a verbal notification. It can be a registry unless the data doesn't come directly from your EMR. Maybe it's a standalone registry where you manually enter that data. Provider abstraction forms, and member self-reported data. Now I want to say member self-reported data, NCQA did away with that within the last few years because they were finding when they opened that up, opened the floodgates up, and what member self-reported data means is that the health plans could actually outreach to the patients, or maybe your practices could outreach to patients and say, you're due for a mammogram, and the patient could say, well, I had a mammogram. And you would ask, well, when did you have that mammogram? And if they could provide you with a date, and it didn't even have to be a concrete date, they could say, oh, well, I had it sometime in May, maybe like the beginning of May. Health plans could actually report that the patient had it, let's say, May 1st. If they didn't know the concrete date, they just knew it was the beginning of May, they could report that they had it May 1st and report that to the health plans, and then the health plans could report it to NCQA. But what they were finding is that a lot of the data was invalid. Patients were saying that they had services done when they really truly didn't. So it was allowing for this large amount of data that just wasn't accurate data. It had no direct proof that the service was even completed. So now a lot of requirements, even if you enter data into a provider portal, you have to fax over medical record documentation to support that, because health plans are audited just as practices are audited, so that they can kind of determine and make sure that the data they're reporting up is actual factual data. So why is HEDIS important? So the overall concept of HEDIS is to improve the quality of care of patients, and through that, it's completing those preventative care services. So studies say that if you are making sure that you're completing preventative care services, you're less likely to end up with chronic conditions because you'll catch them early, because you are in your physician's office at least annually, and you have a less likely chance of getting a disease that's not manageable and ultimately, having not a good healthcare outcome. So the health plans, like I mentioned previously, they partnered with the practices so that way they can incentivize providers who are doing those work. So your practices are actually getting incentives for things that they're doing on a day-to-day basis. Like I mentioned, those mammograms, those immunizations, the lead screenings, the physicals, things like that. So it's giving you the dollars for doing things that you're already normally doing on top of those claims payments that you're getting from the health plans already. So it's just additional incentive dollars. And lastly, so when a health plan gets scored nationally, a lot of health plans, if they've scored pretty high against their peers, they're going to post how they kind of scored against their peers on their websites in hopes that prospective patients will view their websites and see how they ranked against their peers, and if they did very well, maybe they'd want to choose that health plan over a health plan that didn't perform as high. So we'll move on to the next question. The next kind of section we're going to talk about here is why it's difficult to get high quality scores, how you can identify your gaps in care, and lastly, how you can take advantage and earn those incentives. So what has been, for those of you who are familiar with HEDIS prior to, and even those who aren't, what has been your biggest challenge in getting patients and getting high quality scores? If you could select one of the following, then we'll see. I kind of have an idea, if I had to guess in my experience, what I think is the biggest challenge. I'm curious to see what others think. Okay, that's exactly what I was thinking. So non-compliant patients, that is the biggest challenge. So moving on in our presentation, we're going to talk about why getting those high quality scores is a challenge. And number one on the list is non-compliant patients. So non-compliant patients could be patients that only come in once a year, and when the patient presents, they only have that annual physical done, but they don't have anything else done. Maybe it's a female and they're due for a mammogram and they don't want to have a mammogram done, or they're due for a colonoscopy and they don't want to have a colonoscopy. Non-compliant patients can be patients who maybe move quite frequently. You don't have a good phone number or address and you're having a really hard time reaching them. Or it could be patients who you have a good phone number, good contact information, and they just don't return your phone calls, and unfortunately lower your quality scores because they don't want to have services completed. And unfortunately, in a lot of cases, there isn't an opportunity to record if a patient refuses a service. Now, for some of you on the line who you've been awarded into CPC Plus, a lot of you probably are also in an ACO. And you'll notice that if you're in an ACO, a lot of services you can actually document if a patient refuses a service. Whereas with the commercial and the Medicaid payers, it's a little bit different. Unfortunately, they don't allow you to refuse service, and unfortunately it counts against you. So the second reason why it's a difficult time, or it may be a difficult time getting a high quality score in your office, is that you're not aware of the gaps until they're too late. Maybe the patient is scheduled for a sick visit and you didn't realize at that time they were also due for a physical. So you only did the office visit for their sick symptoms, and you missed an opportunity to earn an incentive for a physical because you weren't sure that the patient was even due for a physical at that time. And lastly, I talked about patients don't regularly come into the office. You're not aware of the service until the patient leaves. And lastly, it's billing. So if you complete a service and you have the understanding that the service was completed, you met the gap, you closed the gap, and then ultimately they show up on another list and you're thinking, how in the world did that happen? I know I did that service. It's important to make sure that you are billing appropriately and knowing what those appropriate billing codes are that the health plans provide to you, so that way you can get credit for the services that you completed. But we did talk about previously how most health plans have a provider portal. So if you didn't get credit for a completed service through billing, there's also the opportunity to record it and report it to the health plans via a provider portal or faxing medical records, so that way you can get credit for that service. So next we're going to break down HEDIS measures. So there are different kind of criteria in categories of a HEDIS measures: a numerator, a denominator, and an exclusion criteria. So I mentioned previously that there isn't an opportunity to, if a patient refuses a service, that it would exclude them from the denominator, and unfortunately it would count against you. However, with HEDIS, they offer exclusion criteria, and this criteria excludes them from the denominator. And these are things such as if, let's say, a patient, child, has a adverse reaction to immunizations, so they cannot receive immunizations. That is an exclusion criteria. If mom decides that she doesn't want to vaccinate her children, even if they sign a notice, unfortunately HEDIS doesn't acknowledge that, unfortunately it will count against you. Other exclusions can be things such as if the patient is due for a BMI that year, but they're pregnant at that time, that BMI at that point in time would not qualify, because it's not it's not an actual depiction of what the patient's true BMI is, because they're pregnant at that time. So I'm going to break down a specific HEDIS measure, and the reason I chose this one is because it's a little bit more complex. It's a 3-part measure. So weight assessment and counseling for nutrition and physical activity for children and adolescents. So the numerator is any patient 3 to 17 who has an outpatient visit with their primary care provider. So the 3 components are that they have a BMI percentile recorded, that they are counseled on nutrition, and then they're counseled on physical activity. So the medical record has to support that all 3 pieces were captured in order for the measure to be completely met. So the BMI requirements, so the height, weight, and percentile must be in the medical record. Just the BMI percentile alone would not qualify. You could record and report the BMI percentile. However, if you were succumb to an audit and all 3 pieces of information weren't recorded in the medical record, that it would ultimately not count. Secondly, counseling for nutrition. So the medical record must contain the date and at least one of the following. You had a discussion about current eating habits or guidance. You maybe gave them a nutrition checklist. You gave them a referral on nutrition education. Maybe you gave them information on healthy eating habits in the form of educational materials so that they could take them home, post them on their fridge, whatever the case may be. Any anticipatory guidance for nutrition, or weight or obesity counseling. And the last piece of this measure is the counseling for physical activity. Majority of these criteria are the same for physical activity as they are for nutrition as well. So the denominator for this measure is anyone the age of 3 to 17 years of age. And like I mentioned previously for exclusion criteria, in this particular case, since it's looking for a BMI, if a patient was pregnant during that measurement year, typically measurement year is defined as the calendar year in most cases, then that BMI percentile could be reported as an exclusion. So this brings us to the last piece of our presentation. So we told you what HEDIS was. We gave you a background on it. We broke down what a HEDIS measure is. So how do you put that into action? How do you get credit for those HEDIS services? How do you get those incentives and get those high quality scores? So it's important to determine who your biggest payers are in your practice, who your biggest, largest populations, and focus on those particular health plans and health insurance companies as opposed to the ones that maybe you only had a handful of patients at. So in addition to that, you'll want to focus on those measures that you have the most patients in that population. So for example, for a family practice or a pediatric practice, one that is most challenging is adolescent well care visits, because a lot of those patients, they have school activities, after school activities, maybe they're in college, they're in high school, they just don't have the time unless they need a sports physical to come in and have that annual wellness visit. So it's important to take advantage of scheduling those adolescent well care visits a year in advance if possible, or doing the sports physical and turning it into a well visit, so that way you get credit for both instances. For Medicaid in the state of Michigan, I'm not sure about Ohio, sports physicals are not a covered benefit. So it's definitely encouraged that for those of you who are doing a sports physical on a Medicaid patient to turn it into a physical, so that way you can turn something that was not even reimbursable to something that is reimbursable by a physical, and potentially incentive, because it's an incentive measure from the health plan. Next thing you can do is calculate your potential revenue for your practice if that goal was met. So I mentioned previously that health plans will actually either provide you with a goal, you have to meet a certain goal in order to earn that incentive, or it's a fee-for-service type of payment. So you can actually calculate your potential revenue if you complete all the services or if you meet that goal, and that way you have a kind of a target of, okay, I could earn $50,000 for the practice if I complete everything. And then set goals for yourself. Determine how many patients would have to come in order to meet that performance goal. So how do you identify your gaps in care? So there's multiple different ways of identifying gaps in care or services that need to be completed. So one way is the health plan's report. So the health insurance companies can either have a report hand-delivered by a designated provider rep, or they could be obtained on the provider portal. In either situation, the data is up to date, and it provides you with information on the patient's address, phone number, and the services that are needed. Second way is EMR alerts. So utilize your EMR to identify those gaps. Most EMRs have the ability to set alerts on within the EMR that alert you if a patient is due for an A1C, or they're due for an eye exam or a mammogram. So customize those alerts based on the health plan's incentive program, so that way you can get credit when the patient presents in the office. Eligibility reports. So keep in mind that eligibility reports are a full list of your patients, whereas your gap reports are going to be a subset of that, because the patient might not be due for that service. So the eligibility report is typically going to be larger than your gap report itself. And lastly, primary, secondary, and tertiary prevention programs. So an example of this is if a patient a female has a family history of breast cancer and they're only 40 years old. Guidelines would say that you wouldn't typically screen until the patient was 50. However, if they have a family history, your provider is typically going to decide that they want to screen them prior to that because of their risk factors, such as their family history. So these are a set, the next few slides are a set of the routine preventative services, things that typically health plans are going to incentivize you on. So it's great to know what to look for, what to complete on an annual basis, or a biannual basis depending on the particular service. So this list here, I'm not going to run through it, is a list of all of the child and adolescent measures. Next, the adult measures. And lastly, the chronic condition measures. So it's important to, like I mentioned, to understand what these measures are. understand what is needed to get credit for those completed services. And typically the health plans, when they provide you with their incentive programs, they typically provide you with some sort of educational support that gives you an idea of what is needed in order to close that gap. If you did not receive that information, I strongly urge you to contact your provider rep to get that information, so that way you can be fully educated on how to close that gap. So lastly, I want to talk about the best way to get those high quality scores and to earn those incentives. So these best practices are what that I have found in working with practices have done. These, if they've been implemented in practices, have been very, very successful. So developing relationships with county or state immunization registries so that you can receive that data. So if a patient goes to a health department and doesn't have a vaccine in your office, it's important to have that relationship with those registries so that way you can gather that information and know if the patient is on schedule with their immunization schedule, do you need to do a catch-up, whatever the case may be. Develop relationships with local health departments. Maybe the health department is giving a flu shot or doing some of the women's health services. It's important to develop those relationships so that way you are getting that data on your patients. And check those registries regularly. It's important to get that information so you know what's happening with your patients on a day-to-day basis. Monitor and report exclusions. So I talked about previously exclusions that are available to patients if they meet certain criteria. So it's important to know what those exclusion criteria are so that you can look for it, so you can report it to the health plans so it doesn't count against you. Develop patient materials. So these patient materials might come in the form of reminder letters to patients. You're due for a preventative service. Please contact us at your convenience. And maximize each visit. So if a patient, like I mentioned previously, if a patient is scheduled for a sick visit, take that opportunity to understand what gaps are due and try to hit everything at that time of that visit, because if that patient typically only comes in for a sick visit, you might not see that patient ever again. So it's important to know what gaps are available and due and complete them all at that time of that visit. Complete services by the due date. Know what those due dates are. So it says here that varies by measure. So for some measures, such as a mammogram, there's actually the mammogram can be completed in the last couple years, as opposed to a lead screening, which is due by the child's second birthday. Well visits within the first 15 months of life. So they need to have X amount of well visits before the child turns 15 months of age. But then there's services, things like A1Cs, where they just have to have an A1C within that calendar year period. So it's important to know what those due dates are and monitor them so you can complete them before the close of the due date. Use the billing codes that are indicated by the HEDIS measures. So I mentioned working with the health plans if they haven't given you the billing codes for the measures, so that way you can get credit for those completed services. Code to the highest specificity. So to add to that, make sure you share those billing codes with your biller so that way they're aware of what to look for and how to code to get credit for those completed services. Engage with your health plan representative. This is really key. It's important to have a relationship with your provider rep so that way you can have an understanding and have that open communication on how you can better manage your patient population so that you can get credit for those completed services and earn those incentives. Educate your practice on health plan incentive programs. So oftentimes I see there's only one key person in the practice who really is the subject matter expert on HEDIS or particular population health programs, and all the other support staff are doing the work and doing what needs to be done, but they don't know why. They don't have an understanding of why they're doing what they're doing. So it's important to explain to your staff, this is the reason why we're doing what we're doing, and it often will, trigger a light bulb. Oh, that makes complete sense. Now I really get it, and you'll have a better outcome of their attitude about why they're doing what they're doing. And lastly, this is one that I really enforce with my practices. Adopt the strictest requirements and apply to your daily routine. So if health plan A requires one thing and health plan B requires another, whatever the strictest requirement is, adopt that for everything. So that way you don't have to remember what requirements meet what for each health plan, and you can just complete one particular way and get credit across the board. Set short-term and long-term goals. We talked about this a little bit so that you can have a better opportunity of earning your goals and making your goals at the end. It's important that if you have a large list of gaps in care, if you have a 20-page report and you are just completely overwhelmed, set the goals so that way, set short-term goals so that way it doesn't seem so challenging and it can be a little bit more attainable. Understand your patient population. Learn from the past. So if you've made mistakes in the past, maybe you didn't take advantage of the sick visits and didn't turn it into a physical, take that opportunity and learn from that past. I already talked about supplying your biller with those codes. Register for health plan portals to track your performance. So I mentioned previously that the portals have your patient information on it, patient gap lists and whatnot. This will also give you the ability to track your performance and how you're doing, because those portals are typically real-time data, whereas opposed to a provider rep dropping off a paper gap list, that data might be outdated by the time they walk out that door. And lastly, educate, educate, educate. So this falls on your staff, on your providers, and on your patients. It's important to educate and give them all of the tools that they need to succeed in meeting those goals. So earning financial incentives. So I mentioned that some incentives are paid fee for service. They might be paid directly on the claim. Some health plans offer monthly payments, quarterly payments, annual payments, or actual a fee schedule update or uplift on select billing codes based on your quality scores. So to recap, HEDIS is a set of quality measures used to measure performance. The health plans identify the need to work with the providers in order to kind of help each other. That helps the provider by earning the incentives for doing the work that they do on a day-to-day basis, and it helps the health plans get a better score ranking across the nation. And then lastly, maximize your incentive potential. Identify those gaps, set goals, monitor your performance, and ultimately you'll earn incentives.
All right, fantastic. Thanks a lot, Amanda. So before we start to wrap up, there are a couple of questions that came in. They're kind of related to each other, so I'm going to try to just paraphrase and maybe try to stitch them together. It's mostly around the how. So you covered any number of best practices and things to implement within the practice. A couple of the questions relate to, well, how do I do, how to operationalize this? So as you're advising your practices, are there, particular members of the staff that you would recommend getting involved? Is there a process like a weekly meeting or a status meeting? Any other kinds of things that, just make these practices just part of the fabric of an office?
So I definitely recommend, thank you for the question, I definitely recommend that at least one person in the practice is aware and understanding of the incentive programs and what HEDIS is and how it impacts the provider's incentive opportunity. For larger practices, I would recommend a multi-person team to share in the work and to also have the ability to have a backup person. In some practices, large practices, they actually have like a team of staff that work together, and they split the work up, and each person has a different take on things, and it allows the practice to have constant communication about how they can work together to achieve quality scores. It's important. If you have one person, it makes it difficult to kind of hear each other's views and determine things to do outside of the box in order to maximize those incentive opportunities. So if you involve more team members, you have a better opportunity to get feedback from staff who maybe are doing the patient work, the MAs who are actually working with the patients. They know those patients based on, being in the room with them. They might have better feedback than somebody who maybe is more of an administrative role.
Very good, very good. Okay, well, why don't we go ahead and just start to wrap up. For those of you participating in the CPC Plus program, please know that Medical Advantage Group has a number of services available to help you be successful in that program, from work in your IT or EHR to some of the practice coaching, like what Amanda does every day. From a compliance offer that just keeps you compliant with the due dates and submissions that you're required to make as part of the program. Medical Advantage Group, we recognize a lot of names on the line here today, but for those of you who are new to Medical Advantage Group, we're a healthcare consulting company basically that's been helping practices for a lot of years succeed in value contracts, grant programs such as CPC Plus and other things across Michigan and Ohio. More information about our CPC Plus program is available online if you just go to the link that we've put at the bottom of the slide there. And finally, our next webinar is coming up later in May the 17th. Please feel free to register if you'd like to hear about maximizing HCC coding. We'd love to see you again. For those of you who'd like to talk to someone in Ohio, our business development contact is Sherry Kent. You've got her information there. For those of you in Michigan, it's Jeff McKay. His information is there. If you'd like to follow up directly with Amanda, here's Amanda's email. So Amanda, thank you so much for joining us here today. Great job as always. And for those of you listening in, thanks for joining. We appreciate your participation. Like I mentioned at the beginning, we will be following up with the materials and the recording. And with that, we'll say farewell and have a good rest of your day. Thank you very much.